Is this okay? I think it's okay now. Thank you very much for introducing me, Dr. Nagai. Good evening. The chairman of Asian Pacific Division, WFLD, Dr. Shen, all of the ECHO committee, member, friends, and colleagues. This is my very pleasure to have a chance to contribute in the second webinar of Asian Pacific Division, WFLD. And I would like to share with you disruption of laser in dentistry, the post-pandemic. I think we like to share the way that our laser in dentistry research group, Khon University, respond to this. Let's have a look at the situation of the COVID-19. This is some data from WHO in terms of new case reported by country, region, and transmission classification. And you can see here the country. I think we are the same situation in every country. Still, we have newly case confirmed more than 100 to over 10,000 a day in every country, I think, including our Asian Pacific region as well. By region, it's still ongoing. As you can see here, the peak and the waves of the new cases are vary by the region. By transmission, you see half of the transmission is community transmission, and another half is cluster of cases. And I think our part in Asia seem to be cluster of cases transmission. So those data bring us, I think, clearly that we still in the pandemic COVID-19, actually more than a year, and we don't know how last is long. That means we have to dealing with the new normal by changing to be as usual, I think, at the moment. And I think the way that we think as usual, because we cannot traveling around across the country. The healthcare system, I think, is changed. We need to help each other by the global network, but work as a local-based facility. Treatment and prevention in dentistry and medicine need to be balanced between efficacy and risk factor of transmission. In terms of the technology, I think we based on the online and remote instruction. So need to be designed as a user-friendly and universal design. Education, of course, more online than on-site. Shall we approach it this way? Shall we approach it that the disruption give us a chance to develop our field in laser dentistry? And I would like to share with you how our research group think about this and try to develop some new thing in laser dentistry by 3 areas: laser safety, laser therapy, and laser education. Let's have a look at the laser safety. I think, of course, more protection in the viral transmission. Besides this, awareness of the hazards of using photonic machines. Okay, move on to the first issue concerning the protection of viral transmission. I think you all know about this. The transmission of COVID-19 or SARS-CoV virus, mostly by direct contact of the secretion from the infected patient. Besides this, the indirect contact of the surface contamination and the airborne. Regarding our dental treatment, using the drill, ultrasonic scaling, and of course, the soft tissue laser surgery and the hard tissue laser ablation, we produce aerosols. And what's concerned us is bioaerosol potentially transmitting infected disease. Let's have a look at the laser pruning. I think the researchers and case reports show that the ablative effect of laser produce laser pruning containing various kinds of organic hydrocarbon, viral DNA, the HPV, HIV, including bovine papilloma virus. And if you think about this, I think this is a possibility that it can also contain coronavirus as well. Therefore, our research group, we improve the protocol of the laser safety. Okay, using the laser in standard airflow and ventilation room. For the high intensity therapy, we add up extra oral suction and also advise the PPE equipment, including N95 mask. And we must serious about more accurate laser parameter for sufficient outcome and less pruning producing. The second part of the safety, I think more awareness on photonic hazards. I think some of you may came across this article from Professor Envimiga. He stating the possibility of photonic as a LED, laser, blue LED for treating and preventing infection, including coronavirus. This is promising kind of review. So I think in the future, there will be bring more application of our daily use blue LED, not only for killing composite lasing, but also other purposes such as disinfection. According to those facts, our young researcher, the undergrad student researcher, try to explore the wavelength of the various kind of blue LED that we use in our faculty. And I'd like to bring you to the attention. One of the interesting findings is all of blue LED can emit at least one wavelength of the infrared, like 800 nanometer, 810 or 980 nanometer, at the power density of more than 500 milliwatt. That means it fell in the category of classification 4 of laser hazards. Therefore, the strictly eye protection for patient and dental health personnel must be advised. Okay, we move on to another part of laser therapy. I think tend to favor to the side of less pruning to non-ablative technique. Besides this, photobiomodulation therapy is very interesting field to invent more technique. Sorry. Okay. All right. Move on to the first part about the laser therapy. I think I'd like to show you some example of our non-ablative technique. This is the group of the young researcher conducted clinical trial of non-ablative laser technique for depigmentation of gingiva. This used for the purpose of aesthetic concern in the case with physiologic hyperpigmentation of the gum. You can see here, this is a concept of non-ablative technique by using the diode laser 808 nanometer, of which the property more absorbed by melanin than hemoglobin and water. So by doing so, we can coagulate the melanin without getting abrasive effect of the mucosa. The objective of this clinical trial compared to setting up 3-watt continuous and 5-watt repeated pulse, and also the patient satisfaction. A double-blind randomized control trial was conducted in 10 subjects in the principle of split mount design. And you can see here the way that we record the measurement outcome based on standard GOPI, and we develop our gum shade score using with the shade guide, like a composite laser shading guide. And the picture shows you that the way that we test, we do the test patches to the patient and let them come back in 2 weeks' time for evaluation. And they will give us the satisfaction of the treatment, the color, the time of the treatment, together with the complication. Then we ask the patient to select the color that he likes for treating the whole area. The 4-week evaluation was also recorded. In conclusion, to setting up that we use is quite significantly increased gingival pigmentation to the level 1 of the 2 standard of the record. For 4-week follow-up, there was no recurrence, and all volunteers, they feel happy with the color of the gum, and also the treatment, the procedure is acceptable. Move on to another non-abrasive technique. This is the way that we remove the tissue with non-invasive method by using photodynamic therapy, PDT. The principle of this, we use the laser to initiate photosensitizer producing reactive oxygen species into the tissue. This results cellular apoptosis as well as biomodulation, and end up with the remission and prevention of oral lesion. We'd like to show you the example of this. This is a gentleman who suffered from the lichen planus of the both cheek, and we use a PDT with 10% aminolevulinic acids as a sensitizer and initiate by 635 nanometer of the laser light. By 6 episodes, you can see the distinct remission occur. Normally, we ask the patient to come in 3 months' time, and the top-up can be used as necessary. Move on to another point of laser therapy. We'd like to show you the example of the novel technique of photobiomodulation. As I mentioned earlier, we try to reduce the treatment duration, and we try to reduce the frequency of the treatment based on the pure photobiomodulation. The example here, we conducted the clinical trial to invent the technique which is called laser welding by using diode laser 808 nanometer. And I think other type of wavelength from 800 to 900 will do the same trick. The setting up of energy density at 7 joules per square centimeter delivered by optical fiber. This was compared with 0.1% fluocinolone acetonide for treating patients with erosive type of lichen planus. The result of laser welding and topical steroid was statistically no significant difference. That means we can use either treatment. And this is the example of the application in the gentleman who have no response to the topical or systemic steroid, developed the erosive type lichen planus. we use the laser welding. And you can see from the screen, the immediate effect is very, very minimal. It's not abrasive kind of thing. By 2 treatments in 2 weeks time, this gentleman get on very well, good response. He has complete remission. And we do the follow-up. This is the 8-year follow-up. But normally, in general patients, you can ask the patient to come to see you in 1 month time or 3 month time and doing the top-up. Another non-abrasive technique that I would like to show you, because this is kind of user-friendly, is using photobiomodulation for initiate blood clot. We explore this technique aiming to apply this to the older patient or the patient who have the compromise by the medicine-induced breathing disorder. We use two setting up as an intervention, the diode laser, as you can see the setting from the screen, and also we use the LED, the blue LED, compared with the placebo laser, which is only the pressure. And you can see the data here. There's no significant difference of the time, the clotting time between diode laser and LED, and two intervention, giving faster timing of the blood clot than the placebo, which is only the pressure. This is the clinical application in the patient who suffer from valvular heart disease due to get on to the operation, the cardiac operation of valve replacement. And she was sent to us to eliminate sort of the infection, do the extraction of the upper teeth, and even the INI is only 2, but it developed excessive bleeding. So we need to put vacuum sprint to her. She came back to have the bottom tooth taken out. And this time we used the photocoagulation technique, and it went on very well, getting the blood clot in 1 minute. And the day after that, she can get on with the cardiac operation. Right, so we move on to the last point that I'd like to share you, which is actually my favorite part of talking, is a laser education. Well, the challenging from the disruption is how we can conduct the laser dentistry course by full online. And I'd like to show you the example because we make possible this full online educational course and the networks. This is the example that I'm proud to present this, because we, with the laser in dentistry research group, we transfer the technology to Faculty of Odonto and Stomatology, Cần Thơ University of Medicine and Pharmacy in Vietnam. And I would like to thank Dr. Thao and her team, because it's not just they follow us, but we each other try to develop this to make the online classroom possible. The design of this, for the lecture, for the content, we use electronic module by cell learner, and also provide the live electronic classroom and have the platform of the Google Classroom to hang the information. But the most challenging part, I think, is the part of the laboratory practice. And we decided we produce 2 on site, both of us. We produce the same environment, and then we translate this by the online. By doing so, we can do the laboratory practice together. I think the quality of this is more or less the same as we do on site. And I would like to use this word. This is a hybrid lab practice. All right, this is all for tonight that I would like to share with you how we cope with the disruption. I think this leading us the development in laser dentistry. The novel technique of the laser give the balance between laser safety and the efficacy. And also the laser education, I think in terms of the international collaboration, we can enhance the international network besides transferring the technology. And last but not least, I would like to thank all of our LDRG team to give the support of this. And also I would like to thank our Vietnam team, Cần Thơ University, to help us to make the educational laser possible online. So thank you very much. All right, I pass this to Dr. Nagai.